Hi, this is Peggy Miller. I'm with Highland Winds LLC. Good morning, or afternoon, whenever you're listening to this particular segment. This is the Chronic and Specifics number 10, where I'm continuing with yin deficiency, and I'm dealing with heart yin deficiency in this segment, which has a combination of the same yin deficiency. I've dealt with yin deficiency in the prior three segments, kidney and liver, and overall, and heart yin deficiency often comes as a part of that. So listen to all of the different yin deficiency. Yin deficiency is very important to the overall health and needs to be treated. The body will continue to get drier. Dry skin will get worse. Blood deficiency is almost always existent, so that needs to, fatigue starts to develop, and then finally you'll leap to a key deficiency at the same time. So it's very important to treat signs of yin deficiency. Pinpointing which one you have, usually with heart yin deficiency, it's a combination of the regular yin deficiency signs, usually, which are night sweats or mallard flush, feeling of heat in the hands and feet. But a person can have yin deficiency, and like if they have kidney yin deficiency, they can also have kidney yang deficiency, and then cold will have an onset. And they'll say, oh no, I don't have heat, but there'll be other signs of yin deficiency underneath the yang deficiency. And that's why if you've had this for some time, it's pretty important to consult with a professional, a medical herbal professional, in my opinion, trained in either Ayurvedic or Chinese medical herbalism, because pinpointing what's ongoing and making sure that you treat the various things in the correct order is important. And that sounds complicated, but it's not as complicated as you think. It's just that if you're not trained in these things, it can feel that way. So that's some of the purpose of these different podcast segments, so that you can learn a bit of the terminology and learn to recognize the various symptoms. So with heart yin deficiency, you have often the night sweats, the mallard flush, the feeling of heat, especially in the evening. But in addition, the things that stand out are anxiety, memory issues, agitation, fidget, a person who fidgets a lot, a person who's very uneasy. They'll often complain of a dry mouth and dry throat. And these can all be signs of yin deficiency. With heart yin deficiency, generally what I look for, what triggers my feeling that it's heart rather than kidney or liver, is just that. It's a personal, I'll ask, how is anxiety a friend? Do you often feel anxious? And a person with heart yin deficiency will say yes. They'll just say, I'm too anxious. Anxiety is a problem. And then I'll say, well, okay, how's your sleeping patterns? Now, with heart yin deficiency, often it's a weird, and sometimes clients will say, my sleeping has changed. I don't sleep as well. There's a lot of dreaming. I wake often. Sleep patterns are not good. So these together, anxiety and insomnia issues, difficulty falling asleep, waking up frequently, dreaming, that is heart yin deficiency. I'll then usually ask questions that might indicate they have underlying, which almost always they do, of kidney yin deficiency. Because when you develop the herbal teas, and when I treat people, they usually come to me because they want to start with teas and maybe move to pills, but the teas can be a way of flushing the herbs through your system more rapidly initially. So basically, as I'm learning as you go, and I use the tongue as well, I'll look for a red tip on the tongue. I'll look for what's called a heart crack, signs of heat, signs of yin deficiency in the tongue. And one of the books, and I forget to mention books, which I really should, in addition to the books by the Tierras, Michael Tierra and Leslie Tierra, which are great, Chinese Traditional Herbal Medicine, Volume 1 and 2, The Foundations of Chinese Medicine by Giovanni Masiosia is an excellent tome to have if you've developed a real interest in this. It's something you can refer to. I use it a lot. It's helped me a great deal in pinpointing. Sometimes the symptoms are very overlapping, and the person can have, liver, kidney, spleen, and heart going on, and you have to kind of figure out which one you treat first or which two you treat first, and then get those in a better state and move to the others. Herbs do not work quickly. They're gentle, which is actually really good because they help your body slowly rebalance. They nourish the blood. They help with dryness. And so it's there. What the herbs in the formulas are doing is helping to nourish the heart or the kidneys or the liver, helping to clear internal heat, clear inflammation. So they've got a number of jobs they have to do, and you can't do that really fast. Especially if it's chronic. If you've just gotten this, if this has just happened, that's an ideal time to seek out someone because it can be stopped, in a few days. I have noticed, and I try to watch, and sometimes I forget, even with myself, in winter particularly, because that's a time of lower amounts of energy in the air, lower amounts of vitamin D3. It's your body, if it's a very cold winter like it is here in Montana, you're taxed. Your energy levels are consumed rapidly, just keeping yourself warm, keeping yourself going at a decent pace. And so you have to watch to make sure your ki doesn't get too low, that your energy does not get too low, because when it does, then your spleen will start to complain, and you'll feel more tired. And there are signs that remind me, I forget, and I'll just think, I'm tired, I need to, get some sleep tonight. But it can be my ki is too low. Same with clients, it's watching for different signs. But for yourself, watch for those signs. And if they're just sudden, that's normal, and you just can quickly take one of the formulas. So listen to these different ones and go back to the maintenance sections. If you feel you're very healthy, go back to the maintenance sections and listen to them. Pick the ages that apply to you. Listen to that and use some of those herbs, because that can help just keep you in a very healthy state. But those are some of the books that I use, and they refer to these different conditions, and they can be very useful. Back to heart yin deficiency. Okay, when a person is talking about memory issues or anxiety or sleep issues, I'll try to pinpoint the memory issues a little bit more because, as I've done in a prior one, memory is complicated. It can indicate simply heart issues, and some of the herbs that are used, especially the Emperor of Heaven's tonic pill for the mind, the trouble is there's now, using the same title, there are different varieties on the market. And if the person is talking about forgetfulness and poor memory, or palpitations, or something similar, heart pains around the heart, then you want to make sure that the type of tonic pill you get of Emperor of Heavens includes danshen, and some of them don't. They're quite good still. They're quite good formulas, but it's getting a little bit more complicated, even in terms of being a clinical herbalist, of recommending different brands, because you have to double check that the brand is still producing the formula in the way you intend your client to take. So, Emperor of Heaven's tonic pill helps with heart yin deficiency, and it's excellent. It's a good, if you have heart yin deficiency and, as I said, corresponding kidney yin deficiency, usually you start with the heart one, because of the heart issues. In my training, it was basically, if you see heart signs, that means the heart's heating up. That's not good. It also could mean that there's blood stagnation or mucus stagnation in and around the heart. And if the person suddenly is talking about some of these issues I just discussed, the anxiety, the insomnia, the dream disturbed sleep, some memory issues, if they also say, yeah, I'm feeling those, but I'm also feeling, some anger. I'm feeling some, I just feel some emotions going on. That can be another heart issue, which relates to mucus sometimes plugging around the heart, and it needs to be cleared as well. And you have to decide, do you do that clearing at the same time? I often try to, if I'm sure that it's there. If I'm not, or if I think that those emotional issues are related to the liver, I'll focus on the heart first. And I will work on clearing any blood stagnation potential. I'll use the equivalent of something like Emperor of Heaven's tonic pill, but I might also include one mucus clearing if I suspect that that's a problem related to what's going on. They all fall under the heart, and I was trained, and I agree, treat the heart first. By treating the heart first, many of the herbs in the heart to treat heart yin deficiency and get your sleep back and lower the anxiety level, and hopefully get the memory working, especially foggy brain will usually disappear with this. And as that occurs and the person's feeling better, you'll then go, okay, let's double check now for kidney insufficiency. And that feeling better can occur after a couple weeks on the tea. The feeling more relaxed, feeling a little better, just coping better, sleeping a little better, foggy brain gone, heart feeling better, heart area feeling better, anxiety levels down. All of that can be achieved within a couple weeks, but you still have to stay on this stuff and switch to pills using the same herbs for a couple more months. This is not something you treat lightly. You get it cleared, you get the heart maintained, and many of the herbs also work on the kidney at the same time. So you're getting your beginning treatment of that. Once the heart signs essentially disappear, you then focus far more on the kidney and on the liver, if that's also going on, and you treat both. I hope this has been helpful. That sort of concludes my yin deficiency 4-segment part of chronic and specific, and I'll be moving on to a new topic in the next one. I hope you have a great week. Thanks to MCAT and to KFGM and to YouTube for carrying these on my Highland Winds LLC channel. I appreciate it. KFGM is at 101.5. MCAT's the Missoula Community Access Television. Thank you. Have a good day. Bye.